lost my eyesight for 3 years. Now I am seeing.
It's been 13 years since the United Nations signed into effect the 8 Millennium Development Goals. 3 of these goals fall under healthcare, and Guyana has made tremendous progress in this area. The people are living longer, children have increased chances of survival, and the epidemic of HIV/AIDS, malaria, and tuberculosis is almost under control. Health planning has also benefited from organizations like PAHO. These play a critical supportive role.
Since 1966, the Pan American World Health Organization collaborates with the government of Guyana to strengthen the capacity of the health sector to achieve the highest sustainable standard of health for its people.
The Ministry of Health says the country is on her way to meeting most of the MDG health targets for the 2015 deadline.
Guyana is on the move. A significant indication of this is the increase in budgetary allocations over the past few years.
The guidelines were set out in the National Health Sector Strategy from 2008 to 2012. But Guyana is looking beyond 2015, and that strategy formed the foundation of the long-term plan for health projections and consolidating progress made to date. It is the Health Vision 2020.
Over the last 10 years, Guyana has shown significant progress, especially in the area of health, with many of the indicators improving significantly, among them life expectancy. We have also done significantly better in terms of addressing the communicable diseases, so much so that all of the vaccine-preventable diseases, we are at the point of elimination like the rest of the Americas.
MDG's Goal 4 and 5 deal with reducing child mortality rate and improving maternal health. The Maternal and Child Health Department in the Ministry of Health encourages pregnant women to enroll early in the antenatal clinic to receive all the necessary checks and tests. Particular attention is paid to the quality of intranatal care when the woman goes into labor.
We pay particular attention in terms of the quality of care, in terms of the whole aspect of monitoring of the mothers, in terms of fetal monitoring. As labor progresses, it's done at specified rates, so we're looking at that to improve, and our main goal at the end of during the antenatal care is to ensure that we have a live mother and a live baby.
The service at the hospital, it was great. The nurses, the doctors, the midwives, everybody were helpful. Everything I needed, all the assistance was rendered. There's no complaint. After my delivery, when Antoine was born, bringing him to the breast was very much easy because they showed me step by step on how to do that, and they all encouraged exclusive breastfeeding.
Vaccination is closely monitored, and nursing officer Lorraine Pamela Martin is in charge of all vaccines entering the country and their distribution. She is attached to the Maternal and the Child Health Department, which handles 15 vaccines.
Recently, we have had our half-year evaluation meeting, and this meeting was that we have 10 regions, and all 10 regions, they have presented their vaccine coverage, and it was good.
4 diseases are the leading cause of death in Guyana: cancer, chronic respiratory infection, diabetes, hypertension, and related disorders.
The primary risk factors for those 4 diseases are alcohol or abuse, smoking, unhealthy diets, and physical inactivity. Because we have isolated those 4 diseases and those 4 risk factors as being leading causes of death or contributing to the leading causes of death, the Ministry of Health has taken an approach that, or a strategy that extends from 2013 to 2020, and we will have renewed vigor. We'll be looking at these diseases and strategies to reduce their prevalence.
The world over, HIV/AIDS is an area that attracts major attention, and Guyana is no different. Since the first AIDS case in 1987, the government, stakeholders, and the partners launched a comprehensive response to the epidemic.
The majority of Guyanese know their HIV status. We're able to recognize that we have universal access to care, treatment, and support, with more than 80% of our patients receiving antiretroviral therapy. Today, we acknowledge that we've made tremendous strides in the legislative reforms, as only recently the Parliament and the people of our country rejected the criminalization of HIV.
Eye care is another area which has had a tremendous impact on the populace, with cataract almost eliminated. This was a joint venture among Guyana, Venezuela, and Cuba called Mission Miracle. Through this initiative, a modern ophthalmology hospital was constructed 2 years ago. One of the big success stories is a woman hailing from the interior regaining her sight.
My name is Stephanie Bartholomew. I am from Anai, North Rupununi, Region 9. I lost my eyesight for 3 years. I didn't see anything. Now I've been for surgery. Now I am seeing.
But nearly 3/4 of the population live outside of urban areas. Some 70%, so special focus has been placed on particularly riverine and Amerindian communities. Health posts, health centers, district hospitals, and regional hospitals have been established in the 10 administrative regions. One such area is Region 3, with a population of just over 300,000.
At each health center, we're able to offer the basic services, breastfeeding, immunization. We guarantee oral rehydration when necessary. We educate our patients through various sessions.
Access is relatively easy in this region, along with regions 2, 4, 5, 6, and 10. However, while the journey to the remote regions in the Northwest District and the Pacaramas could be grueling and expensive, health care is still available to the residents. Region 7, the second largest region, is very difficult to traverse. Bartica, considered the gateway to the interior, has the main hospital.
At Bartica, we have a 50-bed hospital, and the services we offered are in and outpatients. We have a laboratory service, a voluntary counseling and testing service. Cancer screening is being done. We have a rehabilitation service. We have a dental outpatient, a pharmacy, our environmental health department. We offer x-ray services and ultrasound, and we have also a TB clinic.
Sometimes the weather proves to be a challenge in traveling by aircraft, which is grounded for days if it rains and the mist is too much for a safe touchdown. Yet, quarterly service is taken to far-flung communities along the border with Venezuela. Region 1 in the Northwest Interior enjoys services similar to those available on the coastland.
For last year, we would have seen about 24,000 outpatients, which may be equivalent to about 50 to 70 persons per day.
Again, this facility is equipped to deliver most services and even boasts an operating theater. Doctors visit fortnightly from Georgetown to perform surgeries. The health outposts are manned by community health workers and the health centers by medics. The regions are overseen by senior medics Zeta Albert, who is stationed at the Ministry of Health in Georgetown.
A medics could be multitasked and is fitted all around within the institution that he or she is being placed. We're also responsible for outreaches along the coastline and in the interior. We are the supporting arm of our medical doctors within the country.
Several key programs have been implemented to put into action the strategies in the delivery of improved health services. One area is that of malaria eradication, overseen by Dr. Riyad Rahman, Director of Vector Control Service in the Ministry of Health.
We have been having a number of cases for the past 3 to 5 years. Added to that, we also deal with dengue fever, Chagas, and leishmaniasis, and not forgetting filaria.
The main thrust of the unit is to monitor, manage, and control the vectors that transmit the disease, an all-year task. Malaria, however, attracts greater attention in the endemic areas located in the hinterland, particularly in the mining and logging communities. The trump card for prevention is the distribution of insecticidal nets, which are safe for humans and are approved by the World Health Organization. PAHO's input includes the package of publicly guaranteed health services, which guarantee that no one suffers financial hardship linked to paying for basic health care services.
And strengthened health system governance and management based on the primary healthcare approach, resulting in, among others, improved equity, ensuring that all people have access to good quality healthcare services, improved immunization and vaccination levels, reduced maternal and child mortality, and an overall reduction of the burden of diseases.
Indeed, things are on the move in Guyana in the health sector. We're creating a new, young, vigorous, expanding workforce, both at the level of the doctor cadre and the nursing cadre. And at the same time, we're expanding significantly the infrastructure, not only in the areas where traditionally hospitals were built, but in far-flung areas.
With just under 2 years to the MDG deadline, Guyana's Health Vision 2020 aims at consolidating progress in health outcomes and system strengthening, accelerating the closing of remaining gaps in the MDGs, and establishing a post-MDG agenda for the country by expanding universal health coverage and enabling health-enhancing behavioral and cultural changes in and through the delivery of improved health services.